About 2/3 of people anyway will have some kind of visual problem. And the sort of problems people can have can include something called central vision loss, which you can see that picture there and that picture there. And it gives you a little bit of an idea what central vision loss is like. For example, say if somebody might keep asking you for the time all the time and you might keep saying to them, look, well, the clock's only there. But it could be that they actually just can't see.
You might think they've got a memory problem and they can't remember where the clock is.
But it's not that at all. It's just that they can't see the hands or the numbers. Visual field loss is common as well. That's an example of visual field loss, and that. And that's people with visual field loss might not be able to see things to the side of them where they have the loss of vision, which means they could be at risk of banging into things or falling over things. But quite often, when people have a visual field loss that they know about, they are able to compensate. So they will scan the area where they've lost the vision to make sure they're safe to go. But there's also a thing called visual neglect, which is when people are actually unaware of their loss on that side, which means they won't be looking for dangers on that side. They might not see that food on that side of their plate, for example, or they might not dress that side of their body. Sometimes people have eye movement problems as a result of a stroke, and that can include things like difficulty tracking objects.
They wouldn't be able to read the paper.
No, they wouldn't be able to read the paper because they'd be all over the place, wouldn't they, visually. Jumping eye movement. I think a lot of people can end up feeling quite nauseous, and it can increase people's fatigue as well if they have eye movement problems. People with eye movement problems could benefit though from referral to an orthoptist, who might be able to introduce some therapies like eye patches or eye exercises to help. Yeah. So you can imagine how that would make somebody feel if they had that all the time. Also, some people have visual processing problems, and that isn't to do with your actual acuity of vision, your sharpness of vision or your eyesight. It's to do with the way your brain processes the things that come in through the eyes. So some common problems that are about visual processing is when people can't see an item against its background or can't identify what an object is, for example, or they might not be able to measure the depth of something. Have you ever seen somebody trying to pour water and they just keep missing the cup? That kind of thing.
And the thing about visual problems is that looking at a person, it's a hidden disability, isn't it? You wouldn't necessarily know. And if someone, we've just talked about communication problems, if someone's got expressive problems, they can't tell you as well that they can't.
Okay.
So you might keep giving someone a paper every day to read, thinking you're doing them a favour, and you might think, oh, the person's really unmotivated, they never bother, they're not interested in anything. It might not be that they're not interested in anything, it might be that they've got central vision loss, or they've got this problem, heminominous hemionosis, or they're missing strips. They can't read what's on the text. So it's difficult because you don't know, do you?
Yeah, and if they don't know either.
Yeah, and if
as in with visual processing problems, some of the visual processing problems.
So the other, I suppose, hidden problems after stroke are problems with cognition. So what we mean by cognition, it's all the mental processes that happen in your brain. So things like attention. Sometimes, if you go to the cinema, you need sustained attention to follow the plot, don't you? Over a long period of time, you have to concentrate and attend to what's happening on the screen and follow the storyline. If someone has problems with attention, they wouldn't be able to read a book and follow the plot, follow what's happening. They just couldn't concentrate for that long. Maybe they can't attend long enough to finish the meal. because they get distracted easily and they can't concentrate. Also, people can have problems with their memory after stroke. So I know a lot of your residents, if they have dementia, often they'll have problems with their short-term memory, their recent memory. So those people often are almost living in the past, aren't they? They remember what happened, they remember their childhood in really great detail, but then they can't remember what they had for breakfast. Or they can't remember having a conversation, or the fact that you took them to the toilet 5 minutes ago, they'll keep asking. So when people have a stroke, they can also have these memory problems, or they can have problems with their working memory, with their short-term memory, and also with their longer-term memory.